I'm Ted Dinsmore, President of SphereGen Technologies. Jonathan and I are going to talk for the next 20 minutes, right?
Yeah.
We started this partnership at ViVE 2 years ago. We met at one of those meetings, speed dating meetings that they do with partners. So I think it's a great example. While ViVE is really important to connect with each other, I'll let you tell the story better than me. Like, why did you sit down and look at AI? Why were you looking at AI 2 years ago?
The real reason was because if I was in 12 meetings, they would comp my registration fee.
There you go. That's why.
Sat down with Ted, and so, but I did get to sit down with Ted, and Ted immediately started talking about what SphereGen does around automations, and it immediately resonated. Like some of our pain points that we were feeling in that moment, immediately. Sometimes you have to look for opportunities with the folks you're sitting down with, and as we talked about what automation can do, intelligent automation, customized automations. Immediately resonated, and we recognized there's an opportunity here, not just our ROI from a financial perspective, but also thinking about our workforce and retaining our workforce. And so I'm going to talk a little bit more about that.
I want you to give some background on what Klickitat is. We lost our slides. So I'll do SphereGen first. Huh?
You go first.
Okay, yeah, sorry. So SphereGen is a custom software development shop based in New Haven, Connecticut, Toronto, Pune. We do three main things. One is AI and automation. We partner with UiPath and with Microsoft. So we are a services group, but we also do custom development applications. And then we do some pieces in extended reality as well. We're based around in New Haven, Connecticut, near Yale. So Klickitat.
Klickitat Valley Health, we're a critical access hospital in South Central Washington State. We run a rural health clinic. We look for opportunities to spin up the service lines that are relevant to our communities. And I know that's not unique to us, but as a rural health clinic, we have an optometry service, we do dental services, we do behavioral health, we do pain management. And so we wind up with a lot of systems. We do a lot of work with Meditech. We have a great relationship with Meditech, but also we have other systems that require user interfaces, right? That require users to interact with, and that creates a lot of inefficiencies. And so when we think about the workforce at our organization, we're constantly thinking about retention because we live in a town of 3,500 people. We have a service area of 10,000 people. There's only so much workforce. So we don't have the luxury of going out and finding people with healthcare backgrounds that have worked in healthcare. We have to train them, and then we need to keep them. We don't want them to take those skills and go somewhere else. And so when we think about our mission, our vision, and values, one of the things that we preach as we think about engaging in meaningful and lasting partnerships is not just with our patients. We constantly are preaching, if you will, to our staff. This goes from one to another as well. We can't just be focused on extending respect and compassion outside of our walls. We have to take care of one another as a workforce. And so that's where this really resonated. What are the tedious, repetitive tasks that just don't require a person to do? They can be done by a computer. Let computers do what computers do, and let people do what only people can do. And that's where we found a lot of synergy with Ted.
So when you talked about staffing shortages, but you spend a couple more minutes about that, because I think that was a critical thing to
when we met back in 2023, I was the chief operating officer at the time, and we had just had probably 40% of our business office leave. And so they had moved on to other opportunities. They had retired, a lot of them. And so we were missing 40% of our business office. And so like I said, there's just not a workforce that we can recruit in our community. We have to bring them in, we have to train them up, and then we move them laterally throughout the organization. And so those staff shortages create heavy backlogs. When you're thinking about denials management, when you're thinking about claims processing, eligibility checking, all of these processes have manual components to them, especially when we have multiple service lines that we're performing that work for. And so most of our staff don't have experience billing for optometry services in a rural health clinic. They don't know the nuances. Our eligibility checking, we'll talk about some of the actual numbers there here in a moment, but the eligibility checks across the different service lines as well created a lot of inefficiencies. And so we were looking for opportunities to retain our workforce. We were looking for opportunities to drive efficiencies, and we knew if we're more efficient and we're more accurate, we're going to have an ROI that's financial, but also we're going to be able to keep and retain our staff. And so that was the goal of the automations.
We always got to focus on what's the ROI, what's the financial impact. And we went through the process. We worked through how to do the upfront cost and get it to paid for. But what is the ROI? What are you actually seeing? It was a year down now. We implemented last February, I think, right?
Yes. First of all, it was amazing how quickly we could spin up the automations. We had our first automations live within a month, and we started with really simple things. When Ted and I talked, I gave him a couple of use cases, like here's what we would do for automations, and he's like, we can do way more complex stuff than that.
Right.
But we had an immediate resonance with my CFO and HIM manager, who immediately were able to take these tasks, and no longer were they starting their day with these really important but tedious, repetitive processes. They were able to automate those. And now our staff, instead of having trepidation, because they're worried, the ROI comes from what, right? FTE reduction. Like, this has to pay for itself at some point. What we've been able to do is reassign those staff to other areas that we were having a hard time recruiting to. And so now those staff still work for us. They just have different job titles.
More value to you, right?
And tremendous value, because they've moved through the institution, right? They're still in our organization, so they have that historical knowledge of the organization. Now, from an ROI perspective, though, there is real dollar saving. It's not just retaining, it's not just reallocating staffing. When we did the eligibility checking, right? And I think on one of the next slides we talk about this, the actual specifics, our denials follow-up. So my CFO was a little bit hesitant, and now if you go to SphereGen's website, she's on their website giving a video testimonial. And so she was very hesitant at first, like, we're going to make this financial investment, but what if it doesn't work? What if we don't have the ROI? We could invest that in people. We could actually, hire another person to help with some of these processes. But the goal was resiliency also. We wanted organizational resiliency because people leave, right? I mean, people do move on from your organization, and so we wanted to build in that resiliency. So when we look at denials follow-up, we had savings over 900,000. And again, we've only been live for just over a year.
Just under a year.
The one I'm really excited about, in our compliance meeting back in January, we talked about avoidable adjustments. We do reports all the time on our adjustments. And our avoidable adjustments in 2024, we had cut them by half, 50% reduction in avoidable adjustments, to the tune of $800,000 in that first year of savings. And most of that we attribute to automations. We attribute it to eligibility checking and automating those manual processes. Our staff can only work so quickly. Our staff are out on FMLA, they're out on PTO. Our staff sleep, they take weekends off. I tried to stop that, but it happens.
You don't sleep, but your staff
bots
does.
don't, right?
Right, yeah.
Intelligent automations are working on holidays, and they're working on weekends, and they're working on nights. And so those efficiencies are there, and now our staff have much higher job satisfaction. And so from a retention perspective, but also we're taking care of our own, because now they're doing much more meaningful work. This work is important, but it's not that meaningful to them. Now they get to contribute to our mission. They get to contribute to our community in much more meaningful ways and tangible ways. So the eligibility verification was huge for us. EOB remittance, if you're doing the explanation of benefits and you're taking that. And so just being able to automate those really repetitive, this has to be done. It has to be done accurately.
Right.
It needs to be done accurately. It needs to be done efficiently. And so now all of these processes have a significant level of automation. And oftentimes they're logging into multiple systems. So there's, they're not just in Meditech, they're in our dental platform, they're in our optometry platform. They're reaching out to, they're managing denials with payer systems. And so they have to be at those portals.
Right, they have to actually make calls.
Absolutely. And then insurance verifications and those things. So the automations have allowed people to do what people do, and it's allowed computers to do what computers do.
Makes a lot of sense. So when you first started, we were talking about the hesitancy of your staff, and I was on several of those first phone calls, and people were definitely concerned that we were going to replace them with automation. But now, as Lori, your CFO, she went from being a pen and paper girl to loving AI and bots, which is just a great destination, and you're happier staff, increased morale. Those are just real important things.
Two processes in, my business office manager came to me, and she was very hesitant as well about this, because it's her team that's being impacted, and she's worried about, are we going to be able to keep my team? My team has some trepidation over this. So two processes in, she came back to me. And she said, hey, I want to meet with you. And so I actually went down to her office to physically meet with her. And I thought, here we go, right? She's going to start talking about the automations aren't as successful as we thought they would be. Or, I told you so. We should have been investing in people, not in automations. And she says, I've got an idea for some new bots. I've got some ideas for some new automations. And so that's when we got into cash postings, and we started doing some more automations. And then once we had 3 or 4 under our belt, so we've impacted our registration team, PAS, right? we've impacted our accounting team. That was one of the early ones. Our HIM team, and then our business office team. Now we brought in SphereGen. They presented to our department heads and said, here's what we've been able to do. And now we've got 4 or 5 ambassadors within the organization saying, we still have the FTEs, we still have the people, but everybody's satisfaction is up. Culturally, our organization is trending in the right direction in a positive environment. And now we're generating new ideas. And so before I left, Lori, my CFO, is on the phone with Kelly with our next automation ideas. And so once you see the power, once you see the complexity that can be programmed, that can be automated, and then once you see the financial ROI and the staff satisfaction ROI, it just kind of snowballs, and you're just constantly looking for what's the next thing that we can automate.
So what is the next thing that your staff wants to do? We focus a lot with revenue cycle management. What are the things that people are talking about, and what are their concerns about them?
We don't have enough time for concerns around artificial intelligence, right? So there's the security concerns, obviously, those kinds of things. But we're using AI in other areas, but there's still these manual components to it, right? And so we use ambient voice technology in our clinic, and our clinicians are able to see more patients every day because of that. But there's still manual components of even those processes. So what we're looking for is, with some of our early tasks, there's 5 steps, right, that this person has to go through. And we thought, well, we can automate 3 of those. And then as you get into it, it's like, no, we can automate 5 of those. We can automate this entire process. You don't have to have a person touching. So now with ambient voice, we're looking at, okay, how do we take this information and getting it into the appropriate areas of the medical record systems, so that the clinicians are not living in 2 portals anymore, right? And so those things that the clinicians are now doing, the more that we can automate, that staff satisfaction again goes up. And if you think it's difficult recruiting business office staff, getting physicians into a town of 3,500 people.
So now you started out with the business office side, and you're moving into, and we see this in a number of our clients, they start out in non-clinical and they move into clinical use cases.
And we've had a foot in both of those waters, right? I mean, we've done a lot of optimization with Meditech, and we've had, and we've driven just tremendous efficiencies. And the great thing is, we were looking for driving efficiencies, right? Using people for what people can do. We optimized, we did a great job optimizing Meditech, and then it was like, okay, what are the next priorities, and what are the next priorities? And so we're doing that in the revenue cycle space right now. We had a third-party revenue cycle consultant come in, gave us some opportunities. And so now we're looking at how can bots reach out to patients? Okay, we've got the prior auth now. So now a person gets to make some phone calls and try to reach out to patients and schedule. Well, how can we automate that process so we're sending those, once that is complete, now those text messages go out and that person can click on that and immediately be able to book that appointment. So our goal is just to look for the roadblocks. Look, where's the bottleneck that are caused by staffing shortages, and then what can we automate in that process to drive ROI and staff satisfaction.
So your closing advice here before we take questions.
I look at it as we're using AI clinically, right? We're using, and we're using, whether it's ambient voice, natural language processing. This is another tool, right? This is another tool that organizations like ours can use. I think it's critical in rural healthcare, but I'm a little myopic because I've only worked in rural healthcare. But it's very critical that we are efficient, right? I mean, our bottom line, we're tax supported. And so if it wasn't for that, we'd have a red bottom line instead of a black bottom line every single year. We recognize that. So we have to be efficient, and we have to look for opportunities to drive efficiency and accuracy. And that's where automations and intelligent automations can take hold. And so what I'm looking for is, what are the things that our people are doing that people don't need to be doing? Our people need to be interacting with our patients. Our people need to be the face of that, but they shouldn't be doing these other processes. So consider adding it to your arsenal. It's not going to solve all of your problems, right? But it is a tool that you can utilize along with these other, AI and other systems, is a tool that you can utilize. And so consider including it in your arsenal, and start early and start small, right? We got a couple of very quick early wins, and that just drove the momentum. It drove positive momentum behind generating ideas for additional automations. And so start early, start small, build those early wins. And then really you do need to do a lot of communication. We did a lot of communication with our staff because there was a lot of trepidation around, reducing FTEs and those kinds of things. But it was all through, any FTE reductions have been through attrition at this point. There was never, no restructuring, anything like that.
Okay. So we just want to open up the questions now. Questions? Here. I can repeat it. Just go ahead. Just repeat the question, so everybody else, because the recordings can't get it. So your question is, we reallocated staff. How did that impact the IT budget? Yes.
Yeah. So working with SphereGen, so it was we structured the contract so it was a one-time fee.
Right.
We looked at multiple intelligent automation companies, and some of them were subscription based, and others were one-time costs. And so we worked out the contract where it was a one-time expense. And so we do have the annual software expense as well for the subscription. And so the one-time expense for us, we were missing 5 people in the business office, right? And so like there was a little bit of, I guess you could say, financial savings already because we had such low FTEs. Also, patient access was the same way. We saw probably a 40% turnover in patient access. And that's what really actually drove us to the table, was we just couldn't keep these workers who were coming, they had a high school degree. Maybe they were coming from a hotel or food service, something like that. And so we couldn't keep them. They were just dying a death by 1,000 cuts with all the processes they were forced to do. And so we really didn't have an option. We had to make some type of investment, and it couldn't just be in workforce. We were recruiting. And so we did make that one-time upfront investment, and now we pay per bot, I guess you could say, per automation.
For automation, right.
So.
Other questions? Oh, yes, our booth, the SphereGen booth is right over here, 939, if you have questions there. Go ahead. Yes. We're the consulting services guys. We work with Microsoft or UiPath. Yes, sir. Denials? What did we automate in denials?
What's that? The resubmittals?
Yeah.
So I'll be honest, I'll get out of my depth pretty quickly there. Haven't actually processed denials myself. My CFO helped come up with the slide deck there. And so I'd be happy to connect you with her to talk about specifically what we're doing in denials management. But it's the resubmittals of the denials.
Yeah, the initial denial was coming back from the insurance company. So we just resubmitted the denial with the same code. And then there was a second process where we actually used different codes. Authorization denials? Oh, no. We're still doing prior authorization. We're getting the authorization check the day of, I believe, which you weren't doing before, right? Yeah. There are certain parts of the hospital that we're not doing the prior authorizations. We're doing prior authorizations now.
Yeah, we're moving that into our surgery department, surgery clinic department for the prior authorizations. Yeah. So we do the checks every morning through the automations.
Yeah. Other questions? Okay. Well, thank you for your time.
All right, appreciate it.